Thank you, Dr. Urso. I'm going to break protocol here because I'm in charge. Because there's another question I have. And this is the $64,000 question, and I'll have all of you answer it in some way, shape, or form. Why aren't other doctors using their medical skill? Why aren't they practicing medicine? Listen, I think it's appropriate to practice protocols. I mean, you're developing protocols and you're practicing them, but why haven't more doctors thought outside the box and, again, had the courage and compassion to actually treat patients as opposed to follow the compassionless guideline from NIH, just succinctly?
So, succinctly this, when we first came down in March, we were getting messages to go home. And some of those messages were really strong. They basically said, and this is the start, the fear came into doctors' hearts. They said in Texas, for instance, if you use PPE, that you might be criminally liable for interfering with an Emergency Use Act. And it was pretty scary. A lot of us were like, well, what are we going to do? And we're like, well, I guess I won't wear a mask. But that only continued. It was a coordinated attack creating fear, and doctors felt that. And many doctors are actually working in employed positions, and as time went on, they were told in no uncertain terms, if you use these drugs, you probably will be fired. And nobody had to tell them. They're smart people. You don't have to draw a map.
Well, we'll delve in the timeline in terms of when that initial fear, and let's face it, there was so much we didn't know early, but then we started finding things out to the point where we are now 2 years later. But I want to explore that timeline with all of you in terms of, because we have to diagnose what happened. Why are we today in the position we're in today with all we have learned? But we'll cover that. I'm going to have Dr. McCullough kick off the next portion here.
I'm going to finish up just on this last bullet point on pillar number 2, which is home treatment. And I want to see a show of hands in the room. We have roughly 100 people in the room. How many of you in the room yourself have had COVID-19? Okay, it's probably about 70% of this room. How many of you in this room, recognizing there are doctors, there are PhDs, there are attorneys, media experts, other scientists, public citizens, how many of you personally have witnessed censorship, intimidation, or professional reprisal and damage as a result of your advocacy for patients? I want this to be recorded. That is 80% of this room have experienced something negative in their life in trying to promote and help compassionately something positive for patients suffering with a potentially fatal illness.